Hello everyone, this is Glenn Agnarangai, um, and I'm doing my oral presentation with you all. My research question is, what is the relationship between suicide and post-traumatic stress disorder with the members of the armed services? Well, I'll start off with the definition of post-traumatic stress disorder, or PTSD. It is a psychological condition affecting people who have experienced an event like a traumatic event, especially if we're talking about military service members who are deployed. They're usually more prone to experience traumatic events, such as encountering insurgents out in the sector, or just getting shot at, witnessing their battle buddies getting hurt, or or some of them even die. Um, um, so this just a rundown for the PTSD portion. And definition for suicide is defined as deliberate taking or ending one's own life. It is typically an outcome of severe crisis that does not go away, that may worsen over time, or that may appear hopeless. Suicidal thoughts may occur when crisis overwhelms a person's ability with that crisis. And usually, a person has just committed suicide. They, they tend to just end their life because they just don't want to experience the way they're feeling anymore. I'll cover down some statistics. A person with PTSD has higher suicide risk. In early 1980s, Vietnam War veterans died, about 8,000 to 9,000 of them. Um, they died by suicide, and between those deaths or suicides, 17 to 26 is their age group, um, uh, among active duty military service members. Um, some other statistics is 11.4 out of 100,000 service members dies by suicide, and in the army alone, that's 13.7. So just imagine that. Um, well, historically, suicide rate was lower in the military among civilians. But in 2008, the pattern was reversed. In 2009, U.S. Armed Forces suicide deaths outnumbered combat-related deaths for the first time. More than 1,100 members of armed forces died by suicide from 2009. I'm sorry, 2005 to 2009. And in addition, 25% had some form of close or pending misdemeanor or felony investigation. Um, Usually, those service members who has a higher rank, they usually tend to just commit suicide because it's pretty much their career is over, and usually their life has been the military the whole time, and they just did that one thing they regret and ended up taking their life away. However, there are programs out there that available for service members who are experiencing PTSD or thinking about committing suicide. Um, Behavioral health clinics are available through any military installations out there. You also have um, your healthcare provider or your physician. There are hotlines out there, such as this National Suicide Prevention Lifeline, Veteran Suicide Prevention Hotline, and Military Outreach Center, and of course the most popular one for the military is the Military One Source. They're all available for 24 hours a day, 7 days a week. Other programs out there I want to point out is the dog therapy program. It's relatively it's an expensive way to increase. It's a way to increase endogenous levels of neurochemical oxytocin and other important anti-stress in humans, because the the animals are are more accepting to the patients. They don't talk back and they enjoy being touched. So that's usually why a dog is so popular to be used, because they are very comforting for patients. There's also this the Army's comprehensive soldier fitness program. It was designed to increase soldiers' resiliency and strength in the face of combat stressors by developing 5 dimensions of strength, such as physical, emotional, social, spiritual, and family. There's also for the Air Force, they have this landing gear program. It uses proactive approach pre and post deployment to educate service members about combat stress symptoms. Um, uh, there's other ones out there, but those are just the three programs that I really want to highlight. For my second part of the paper, my proposal was to look into the PTSD and suicide programs and services, and we'll make recommendations for change. Um, my argument was the dog therapy program is not actually um, cheap. The comprehensive soldier fitness program is very expensive, and I don't think it works. The Air Force landing gear is almost the same thing as the comprehensive soldier fitness program, and there are things that out there that are better, and it should be given more focus um, out there. Well, my arguments are my other argument is lack of well-trained psychologists within the armed services. It's always been a problem. They're not fully trained, and they can't really give right um, the right diagnosis for or better treatment for service members who are undergoing PTSD or experiencing thoughts of suicide. Um, the the comprehensive soldier fitness program is actually a 121 million research project created by the Army, and it, it requires 1 million participants or soldiers in order to get a good result, or even a good screen for service members in order to get a good result for um, to to give out or to even have an effect. The Air Force landing gear, they do all those pre and post deployment briefings to educate their airmen about combat stressors, but usually they don't cover everything. So, and what the other what prepares them is just to get out there, and because it varies on the terrain or the places they they will be stationed at. But my other the other recommendations for change, I have they have the Marine Corps Combat Operational Stress Control Program, and it has to be emulated by other service branches because it has the most rounded, it's well-rounded program created for Marines, where it's it's given them all these different types of programs within that program to help service members reach their goal and mitigate the risk of getting PTSD, or if they're even having suicidal thoughts, they have these little programs within that program to help out a service member when it needed. Um, Also, um, uh, rather than use the 121 millions dollars for comprehensive soldier fitness program, they can just use that fund to for the warrior transition unit program, because they this that program is actually good for service members because that's where they transition to if even they when they get hurt, or they have behavioral problems, PTSD or suicidal thoughts, they go there and they get closely monitored by competent leaders and get the help they need. And that's all they do down there. Just get the help and get some help and get treatments. And once they're they're good and healthy enough, then they go back to their units and carry on with the mission. But if they can't, then they will transition. They will help them transition to the civilian portion side, like to separate from the service. There's also this wounded warrior program that it's a it's a non I'm sorry, it's a non nonprofit uh, program that helps service members in all branch of services who got hurt or have PTSD, or they even separated from the army. And this program actually organizes sports, um, fun activities, and this way they all the service members can um, share their experiences, thoughts, feelings to the other service members and actually relate. And this way they can vent out what they're feeling, and helps out with the um, treatment part of PTSD or um, suicidal thoughts. And this way they also meet new friends and um, other companionship out there. Um, my other recommendation is just continue the comprehensive soldier fitness program by the Army, because it's just a massive research project and very expensive. And it's just I think it's just a waste of taxpayers' money. I would also like to point out to teach commanders to have guidelines on how to when to use mental health services, because some of the commanders out there don't know usually don't know what to do when they have a soldier in their outfit um, experiencing PTSD or having suicidal thoughts. Also address PTSD and suicide through professional military education, because um, for especially for the non-commissioned officer schools, professional schools, they um, they are the leaders on the front line and interact with the with the younger soldiers, and it's usually they are the one that's most likely will commit suicide, or or undergo will most likely have the higher risk of PTSD.